Very good morning. The objective of this video is to familiarize students with the use of X-ray cone positioning device, otherwise better known as a XCP device. Now we know that our radiography is an integral part of our clinical diagnosis, and we are familiarized with the use of X-ray films. Now whenever we go by incorporating the use of X-ray films as an image receptor for radiodiagnosis for the management or the diagnosis of dental disease, be it caries or periodontal disease, we know that these particular films are used by two particular ways, one by the short cone technique and one by the long cone technique. Short cone technique is also known as bisecting the angle technique, and long cone technique is also known as the paralleling cone technique. Now, as we know, bisecting the angle technique is the one which we use conventionally, in which the film is put at various angulations inside the oral cavity, otherwise supported by digital support using the fingers or using bite tabs, sometimes with the help of your sticking tape, and accordingly the X-ray beam is incident at perpendicular to the bisector of the angle between the object and the image receptor. The image receptor may be a X-ray film. In this case, it's a E-speed X-ray film, and inside it can be a phosphor plate as well, or otherwise even a CCD based radio RVG sensor can be used in that same way. Now, in the situation of bisecting the angle technique, when we do that, although there are excellent indications for that, in which we get the idea about the particular coronal aspect of the tooth and the radicular aspect of the tooth and the periapical lesions in the IOPA view, the inherent problems with the bisecting the angle technique happen to be, one thing is the film flexure. There is a little bit of discrepancy in the way the patient might position it. There can be foreshortening or elongation of the particular object onto the film receptor or the image receptor. So inherent to all those particular technique sensitive things of bisecting the angle technique and all the confounding factors that can influence the particular image that is captured on the image receptor, the more method of standardization of your intraoral periapical views happens to be standardized better by use of X-ray cone positioning devices. What we are seeing here are three particular X-ray cone positioning devices, which are meant specifically for the use of your image receptors in the form of for X-ray films. Now, if you notice, these particular X-ray cone positioning devices are made for specific views for posteriors and anteriors. These two happen to be for the posteriors, this one happens to be for the anteriors. Now, how we position these films within this X-ray cone positioning device is as so. And what has to be noted over here, if we can see within this ring, the X-ray beam will be oriented with the particular film at the exact center of this ring, and when we position it as so, and we direct the beam of the of the X-ray source onto the collimation device onto the ring, the X-ray beam would be incident exactly parallel to that of the film. So in that particular context, we will get less image distortion, we will get less elongation, we will get less foreshortening, and what would be the most important thing is that the X-ray beam being incident onto the tooth will give an image correct onto the particular image receptor. Is this going to be without shortcomings? No. Unfortunately, as a result of the particular portion of the film which is taken into the bite tab, many a times the aspect of the coronal aspect of the tooth are lost in the particular image. Moreover, you can't use it with the particular protruding. What happens, your root canal instruments protruding from the coronal aspect of the tooth in this situation. There are XCP devices which accommodate for the same. In future videos, we will be showing you the modifications. Now, if you are using it for the anteriors, it can also be used for the posteriors in this kind of a way. So when the patient is going to bite on the tap, the image receptor is going to come and being held parallel to the tooth, and the patient will be in a better position and be more comfortable because they would not need to, what happens, orient the film inside the mouth digitally, and it can be held in place by the collimation device, and this ring would give an indication on the positioning of the film and how the collimation device would be oriented towards that to get incident X-ray beams. So this being the principle of LXCP devices, this particular XCP device is used for the left posteriors, and it can be used for the mandibular lowers. Okay, and amongst the particular pairs available, there will be a contralateral version available, which is meant for the right posteriors and for the left mandibular posteriors, like so. So a set of 3 XCP devices can be used for achieving better radiographic standardization of field of view, and it can get more incident X-ray, what happens, beam onto the particular object, and get therefore a more less amount of what happens, image distortion, less foreshortening, less elongation, and as a result better standardization of the radiographic technique, and maybe more what happens, appropriate for estimating the exact level of periodontal bone loss, and to avoid what happens, overlap of the buccal and lingual cortical plates. So this is one particular aspect of what happens, advances in radiographic techniques that we would want to, what happens, familiarize our students with. Subsequent lectures will also have a particular demonstration of the other XCP devices which are available for endodontic purposes and for implant purposes. Thank you so much. Thanks.